Good morning. This week I'm taking conversation with the CEO to Iloilo. I am in Iloilo today and I am in this beautiful place. They call this All Things Green. And this is a perfect place for a discussion with Dr. Bambi Tupas. And Dr. Bambi Tupas is a clinical nutritionist, internal medicine specialist as well, who just arrived from Medical City, Ortigas, to start her practice in clinical nutrition here in Iloilo. We are going to have a very good conversation with Dr. Tupas, and we are going to talk about not only nutrition in terms of food and diet, but also in the context of the evolving awareness of people in Iloilo of the wellness that is going to really grow big as time goes by. So let us spend a little time with Dr. Bambi Tupas. We are going to talk a lot about the future of nutrition here in Iloilo. Welcome to a conversation with the CEO in Iloilo. And we are here in All Things Green. And as they say, all things green nowadays is all things beautiful. And I am with somebody who is really beautiful inside and out. I'd like to welcome you, Bambi Tupas, the new and the only clinical nutritionist in Iloilo.
Good morning daw.
Welcome, Bambi.
Welcome to Iloilo.
Well, I always look forward to coming here. And I am so enthused that I am being brought here in this beautiful place. And I think this is just an appropriate place to discuss what you're going to talk to us all about. Perhaps you can introduce yourself first in terms of your career in Medical City, Maine, or Ortigas, and you're coming back here after 2 years.
Okay, good morning. I am Dr. Bambi Tupas. I am an internist, internal medicine, specializing in medical nutrition, and I just came back from my training at the Medical City, Ortigas. So, I spent my 2 years training in medical nutrition. So basically, medical nutrition is a practice wherein you work hand in hand with the other specialists, especially in the nutrition part of the managing these patients and how they respond to the medications in relation to the nutrition aspect or the nutrition totality of these patients, because medical nutrition per se is a practice wherein you enhance the health of the patient, to enhance the totality of the patient, to enhance the response of the patient to the medications, and you also help those other subspecialties in terms of taking care of the patients, specifically by enhancing the nutrition aspect of your patient. So this is a new practice here in Iloilo, or in the Iloilo province.
I think not just Iloilo. I think everywhere else.
Okay.
People should start looking at food as treatment.
Yes.
And the choice of food actually makes an impact in the way the disease process goes on. Like if you have kidney disease, or if you have liver disease, if you have problems with absorption, that's where the medical nutritionist comes in. And perhaps, Bambi, you can share with us how was it before you left for Medical City, Ortigas? How were things here in Iloilo as far as medical nutrition is concerned?
Okay. Before I left for my training in Medical City, Ortigas, or Medical City, Maine, the nutrition aspect in terms of how it is being practiced here is not that being embraced by the medical community. Nutrition plays a very minimal part in the managing of patients' conditions, and we are not that aware that there is such thing as a specialty called medical nutrition. So, me as an internist before I trained in Medical City, I was not very familiar that there is such a specialty. So when
and that food is just when you have a patient in the hospital, you just order maybe food. A diabetic diet, or maybe a diet for kidney disease, and then it's breakfast.
Yes,
lunch,
Doc.
and
The
dinner.
usual diet that
Yeah,
we
the
do,
usual diet.
the usual diet that we order as internists, that's all. But I didn't have any idea that there is such a practice wherein you specifically look into the dietary regimen of a particular patient being admitted in the hospital. The diet of these patients play a crucial role in the development or in the improvement of the patient while being admitted.
Yes.
So when this training was presented to me specifically by Dr. Villa, I have no idea what it is. And after I
It
do,
was a leap of faith.
yes, Doc, I don't have any idea or inclination after my training. What now? After I go back from training, what do I do?
Okay.
So
Perhaps you can share with us.
yes.
During those 2 years in
Yes,
Manila,
Doc.
what did you find?
So, I was the second one to be trained under the program under my mentors in Medical City. And when I was there, I really appreciated the management in terms of nutrition because I realized that nutrition really played a great part in the management of our patients in the Medical City.
Often overlooked.
Yes, Doc. And
Taken for
then
granted. Yes.
there are specific maneuvers that we do as nutrition specialists in each of our patients, and there's such a thing that hindi lahat dekahon. Na some of our patients need specialized nutrition support depending on their condition, and after a while, you can really see it's different from the other subspecialties because in medical nutrition, after a while, you can really see the improvement of the patient physically after you enter the picture as a specialist.
It's like an
Yes, Doc.
intervention.
Yes, Doc. As a specialist co-managing with the other doctors in a particular patient. So you can really see the improvement, the response of the patient, and then it's very fulfilling for me as a doctor when my patients say to me na, Doc, talagang ako ay nag-improve talaga sa ganito. Kung walang nutrition support, I don't know, baka magstay ako ng matagal sa hospital. So that alone is really parang fulfilling in our part, Doc.
And
Diba?
excited you?
Yes, yes, Doc. I have a purpose. So parang when I look back during my journey as a fellow in medical nutrition at TMC, I can say that parang I have a purpose why the Lord led me to this practice, and then because I need to do something back home.
Yes. And then you came back here sometime September?
July, Doc.
July? Yes.
July.
And you started right away?
Unfortunately.
Right away?
Yes, Doc. Yes, because parang we need to change the mindset of the medical community. Actually, ang plano ko po sana mag-vacation a month. Pero parang I need kasi to make certain changes, specifically sa TMC Iloilo, on how we deal with our patients. Sayang kasi na every day counts in the management of our patients. So,
that's a lucky thing there, Bambi, because no less than the president and CEO of Medical City Iloilo is the one who prevailed upon you to train in the medical nutrition. And now that you're back here, there is no way that Dr. Felix Villa is not going to support you in terms of, you will have to be creating a certain program and a certain team. No? You will need to have a team with you.
Yes, Doc.
And I think it's important that you know how to manage change, right? When you come in here and people are still practicing the usual, it will take a while. And you should not get discouraged when they don't seem to see your point.
Yes.
So now that you've been here since July, with no vacation at all, okay, we will probably give you some time, but how do you see this unraveling, moving on forward?
Okay, so my view or my plans for the medical nutrition team of Medical City, Doc, is slowly we are creating the program specific for the hospital, for TMC Iloilo, but guided by the NMS or the Medical Nutrition Support Team from the Medical City Main. And then we are following the principles of the Medical Nutrition Team at the Medical City Main, and hopefully we can have or we can incorporate all those principles here at the Medical City Iloilo, and then the medical community would eventually embrace the practice,
yes,
and then they will see the importance of the
medical
specific practice to our patients here in Iloilo.
But that's a good point that you raised, because we are now an enterprise. We have now, of course, Medical City Main, which is Ortigas, and then we also have Medical City South Luzon. We have Medical City, of course, Iloilo, Medical City Clark, Medical
Yes.
City Pangasinan, no? And so far, you are the second
Yes, Doc.
graduate of this training program. And the first one is Matel Malasarte, who is already in Cebu. So we need to buy maybe a hospital in Cebu, right? But
We
regardless,
will build Medical City Cebu.
the point is there is that you never really lose connection.
Yes.
And the program evolves, and you have quite a number of mentors there who are also who's who in medical nutrition. We have Nina Sioson, we have Christine Reyes, we have Ray Resurrection. And sometimes when I saw you walking around in the corridors with them, you have become a team. No? That was after maybe a few months since you started. Because I remember that when you started, during the first 2 months, you were crying because you were homesick, right?
Yes, no.
And I said you just have to hang on and things will be all right. And in no time at all, you immediately kind of felt at home there. No?
Yes.
So I think it's important because now, Bambi, I mentioned about wellness. And while medical nutrition is important in nutrition for the disease, no? The most important, of course, would be eating the right thing as a preventive aspect in wellness. No? And wellness movements will actually be unraveling more and more everywhere. And nutrition is going to play a part. And nandun ka, you will be right there. Nutrition, for instance, among children,
Yes.
you will be playing a part there. Well, the problem here in Iloilo, it's not a problem, but the reasons why a lot of us would like to come here in Iloilo is because of the food. No? You think the food in Iloilo are healthy?
50-50.
Okay.
Because remember that Iloilo is a
It's
food
known for
hub.
the food, yeah,
Food
yeah.
hub.
Mhm.
So we have different types of food for different groups of individuals here. And then sometimes, as for the general population, they don't know if what they are eating are healthy ba or enough, or are they taking too much. So that would be one aspect that we need to guide them in terms of choosing the right type of food, the right amount, and then we need to educate them of the effects of obesity or anything that could harm their health because of their intake. So yeah, I agree with you, Doc, that here in Iloilo, we really need to change the mindset of the community, the mindset of
eat in moderation.
Yes, Doc. Mindset of the doctors also, and also we need to incorporate really good nutrition in our everyday lives, and then we should think that our food should be our medicine, and medicine should be our food.
That's correct.
So
those are interesting sites before us. Let's see what this is. Maybe you should try it also. Have they cleared this with you?
yes, Doc.
Okay. And that pizza,
That's
it's healthy also.
vegetarian.
Vegetarian pizza. Okay.
Okay.
Bambi, as a way of closing this interview, now that you're here, you have missed your two daughters and Dr. Tupas, no? Eugene Tupas. How do you see 2022 in terms of
So,
medical
nutrition.
And how do you see your role evolving here in Iloilo? Because I understand that there's no other medical nutritionist in Iloilo.
Yes,
And
Doc.
even in Western Visayas, no? And probably because of the fact that now we are able to communicate by Zoom, by webinars, that you may be playing a big role, and you said you mentioned about the purpose, your purpose and your role, and you mentioned about the Lord, that you probably can make a difference not only in Iloilo but also in Western Visayas. So again, the question is, how do you see 2022? Let's start with 2022 first, and then onwards.
Okay. So for me, I view nutrition support team as an evolving practice here in the city and hopefully in the province of Iloilo. Because as of now, we are geared towards healthy living, healthy lifestyle. So most of our patients or most of the people in the community are more aware of how changes in lifestyle play a great role in their eventual status in terms of their nutrition or in terms of how they would develop certain diseases in the future. So I see myself as an advocate of good nutrition for the different age groups, and hopefully I can help them in improving their health, their status in terms of their totality, their health, their condition, and I view nutrition to be as a major aspect in terms of healthcare, just like cardiology, diabetes, or other practices. I view nutrition as a part of their total health care of every individual here in the city or here in the province of Iloilo, and hopefully they would embrace a healthy lifestyle as part of their how to manage their health, their body.
People should embrace it, really. And I think more than just an advocate, Bambi, I think you need to be a catalyst. You really need to, change is not going to be easy, and you need to get these people to understand the change of mindset you talk about. So you need to catalyze the change from the old ways of doing it into the present one. No? And we are so happy. Medical City Iloilo is so happy, and I'm sure Dr. Felix Villa is so happy that after 2 years you're here and you're ready to go and you're ready to fly. And as the CEO of the enterprise, I am so happy that we are now providing all the necessary elements, no? And the necessary expertise as the Medical City enterprise moves on and tries to achieve its vision of leadership in healthcare. You will be playing a big part there.
I will try, Doc. I will do my best.
And so with that, I'd say thank you very much. Thank you very much, Bambi.
Thank you, Doc.
And maybe you should have a vacation maybe in 3 months' time. Okay, thank you very much.
Thank you.